Hi everyone, I'm Robert J. Bailey, CPA. Now, if you're considering a Medicare Advantage plan, there is one rule you absolutely need to understand before making your decision. Many seniors believe they can enroll in Medicare Advantage, try it out for a few years, and then switch to a Medicare supplement, also known as a Medigap plan, if they decide they don't like the Medicare Advantage. Unfortunately, that's not always true. In some cases, waiting too long can result in losing important protections that make it difficult or even impossible to obtain a Medigap policy later without medical underwriting. Now let's walk through exactly how this works. When you first become eligible for Medicare and enroll in Part B, you generally receive a 6-month Medigap open enrollment period. During this period, insurance companies must sell you a Medigap policy regardless of your health conditions. Let me repeat that. During this period, insurance companies must sell you a Medigap policy regardless of your health conditions. They cannot deny coverage because of pre-existing conditions. They cannot charge you more because of your health history. This is one of the most valuable protections available to Medicare beneficiaries. Now, let's say instead of choosing an original Medicare and a Medigap plan, you enroll in Medicare Advantage. Many people do this because Medicare Advantage plans often advertise low premiums and additional benefits. Here's where things become important. Federal law provides what is commonly called a trial right for certain people who join a Medicare Advantage plan for the first time. If you enrolled in Medicare Advantage when you first became eligible for Medicare, you generally have up to 12 months to decide if you want to return to original Medicare and obtain certain Medigap protections without medical underwriting. But after that trial period expires, things can change dramatically. Many people assume they can switch from Medicare Advantage to Medigap at any time and receive guaranteed acceptance. But that is not generally how the rules work. Outside of certain protected situations and some state-specific rules, insurance companies may be allowed to use medical underwriting when you apply for a Medigap policy after your guaranteed issue rights have expired. Medical underwriting means the insurance company can review your health history. Depending on your health, they may accept your application, charge a higher premium where permitted, delay coverage for certain conditions, or decline your application altogether. That is why the initial Medicare decision can be so important. A healthy 65-year-old may think, I don't need a Medigap plan now. I'll get one later if my health changes. But when health changes occur, that may be exactly when obtaining Medigap coverage becomes more difficult. Now, there are exceptions. Some states provide additional protections beyond federal law, so please know your state's rules. Certain guaranteed issue rights may also apply when specific events occur, such as plan terminations or other qualifying circumstances. But those protections vary and should not be assumed. Now, the lesson here is simple. Before selecting Medicare Advantage, understand not only today's benefits, but also your future options. Ask yourself, if I develop serious health issues several years from now, will I still be able to obtain the Medigap coverage I may want? That question can have a significant impact on your future health care costs and provider choices. Now, at this point, you may be wondering, if these rules are so important, why didn't someone explain them to me? And that's a fair question. Many insurance agents do an excellent job educating their clients. However, many Medicare appointments focus heavily on the immediate benefits of a Medicare Advantage plan trying to lower costs. You may hear about low premiums, prescription coverage, dental benefits, vision benefits, transportation benefits, and some other attractive features. Now, what is sometimes missing from the conversation is what happens several years later if your health changes and you decide you want a Medigap policy instead. Now, that's not because every agent's trying to mislead you. In many cases, the client isn't asking the question, and the agent's focused on helping them select a plan for the upcoming year now. But as a consumer, you should understand not only what you're buying today, but what options you may be giving up tomorrow. The question isn't whether Medicare Advantage is good or bad. The question is whether you understand the trade-offs before making your decision. Now, in my own case, the recommendation I received was simply to enroll in a Medicare Advantage plan. There was little discussion about any future Medigap eligibilities, medical underwriting, or what could happen if I wanted to switch later. Fortunately, I had done enough research to understand the issue, but many seniors don't, and that's exactly why I'm making this video. Now, as always, this video is intended for educational purposes. It is not individualized insurance, legal, or tax advice. However, if you did find it helpful, please like, subscribe, and share this video with someone approaching Medicare eligibility. I'm Robert J. Bailey, CPA, and this channel is dedicated to keeping more money in your pocket where it belongs. Please be well, and I'll see you soon.